I'd like to talk about the stethoscope, a tool in my practice. Prior to the stethoscope's invention, physicians examined patients by placing their ear on the patient's chest to listen to lung sounds, as seen in this picture. The stethoscope was invented in 1816 by Laennec. It consisted of a light-colored cylindrical wooden tube, as shown in the picture. Physicians used this stethoscope to listen to patients' chests. There was little change with the stethoscope until the early 1900s when the binaural stethoscope was developed by Kaman. This is the monaural stethoscope, and this is the binaural stethoscope. Use of the stethoscope was associated with physicians for a long time. Nurses later used the stethoscope for measuring patients' blood pressures. In my early years as a registered nurse, I used my stethoscope to measure mostly blood pressures for patients. As the role of nurses evolved, tasks that were originally associated with physicians were now being carried out by nurses. The use of the stethoscope to listen to the lungs, heart, and abdominal sounds required competency, and mainly nurses in the ICU, ER, and advanced practice nurses acquired this skill. I became an ICU nurse a couple years after graduation, and so was trained to use the stethoscope for more than just doing a blood pressure. I have used my stethoscope as an assessment tool to collect data about my patient, which I then analyze in order to identify my patient's needs. This tool is a key component of my practice. I am responsible for the proper use and interpretation of the data I collect. Interestingly also, the stethoscope is no longer owned by one profession, but today, physicians, nursing, physiotherapists, among others, use the stethoscope. According to Sandolowski, 1996, an object such as a stethoscope is often used to represent nursing itself. Many pictures we see today in the media display nurses. They usually are carrying a stethoscope. Nurses at the bedside in all areas of nursing now use their stethoscope, not just for measuring blood pressure, but for doing their head-to-toe assessment of their patients, listening to lung sounds and abdominal sounds, and blood pressure monitoring as well. Thank you.